drive towards value-based care is really starting to happen. Adoption is obviously is not great right now, but we know the movement is there, and that is really towards wellness. If we can treat our patients where they want to be, our senior citizens, we can manage through remote patient monitoring, through chronic care management, multiple diseases, and again, medication adherence and things like that, then we're going to see the wellness opportunities really expand and improve. And the funding mechanisms are going to be key in driving this, because, as Cheryl's indicated, if you're in a throughput business where you get paid to actually see patients in your clinic versus paid to actually care for them, you've got to change those financial incentives. And I have the luxury of working across the country, and value-based care has a bigger presence in areas in Southern California, in markets in Florida and Texas versus, say, the Midwest. So what we're seeing is that mindset change towards wellness. And that is all about patient engagement. And it's all about the technology to interact with your patient when they're not in between the four walls of care. Kaiser does a good job with that model. And I think you're seeing a lot more organizations, that have the leadership, and have the guidance to start to embrace that.
Charles, what would you add to that?
Nothing. I think Steve did a really good job with it. We have what we call enabling services throughout my practice. And these are services to our patients that don't generate revenue typically, right? So we have cooking classes for diabetics. We have group visits that we're not compensated for. We're able to use our population health tools to reach out to folks that need some TLC, and we have adopted the Stanford model for diabetes education, where it's patient-led after a period of time. That's had some successes for us as well. But I think, paying attention to folks that are not compliant with the basic blocking and tackling of the preventive model, you do that well, a lot of things start to happen for you. Shasta County is if you look at the county health outcomes, they're posted every single year. We've seen some improvements since I've been here, so it doesn't happen overnight, but we have folks passing away from colorectal cancer screening. That's a crime. That's just a shame that such a slow growing preventive cancer can't be tackled. And if you know about it early, you can handle it. But once it gets to the point where you're being admitted to a hospital, you got real problems. So those types of things, I think technology plays a role in identifying who they are. And then, our teams know who they are. So if they plan their day properly, they can take care of those opportunities. And then technology through Portal for depression screening, for example, that doesn't have to go through the clinical team per se. So if you think about what on that list of preventive measures, what can you handle, right? That doesn't require the provider. You have to start thinking about that. It's a stark betrayal to the fee-for-service model, but you do have to do it.
One of the things we've been talking and working with a lot of clients on is the whole chronic care management, right? There's so much of the chronic care management with our patients that can be automated, because a lot of it's reminders, following up, checking with the patient, seeing where they're at with their diagnoses and how they're dealing with the prescription and treatment that they're getting. So we're seeing a lot of that as a big way technology is playing to help change that model today. And in some cases, actually helping create different revenue streams that are coming into the healthcare institutions.